Next up is Ed Cole with Lending Club Patient Solutions.
Thank you so much for being here. Yes, my name is Edward Cole, and I am with Lending Club Patient Solutions, and I'm going to talk to you for the next 10 minutes about patient financing. Very exciting topic. You know, we have heard and will continue to hear about amazing technology. One thing to keep in mind about the 21st century and all of this amazing technology is, does it do you any good if the patient doesn't have the resources to make that a viable option? Does insurance typically cover 21st century care? Correct answer is no, it does not. So I'm going to talk to you a little bit, I'm going to give you some tips, a best practice, regardless of what you use for patient financing, that will increase case acceptance. There is something that we do know about. It is consumer behavior. I've got a background in economics, MBA. I can't talk clinical dentistry, but I do know how patients, how consumers make decisions. So I'm going to share something with you. So it really doesn't matter if it's us or a competitor. If you have patient financing, I'm going to give you a few good ideas. Then I'm going to give you some things to consider when you do decide what patient financing solution that you want in place. And whether you realize it or not, everyone offers patient financing. Do you accept credit cards? You accept patient financing. Okay. And then I'm going to talk a little bit about cost and some of the payment options and what distinguishes Lending Club uniquely compared to some of the other options that are out there. All right. Got this great acronym. Sometimes you come up with a great acronym and you got to fit some words in there to make sure that the acronym is spelled right, but we're going to go through this here. First one is people. You got to present financing options to everyone. I'm going to challenge some mindsets, probably, okay? Because I bet there's some folks in here that can say, I can tell when someone needs financing. The reality is you can't judge a book by its cover. You probably have lots of patients that come up that'll surprise you. They pull up in an old beat up pickup truck. They just have cash, or they can absolutely pay for that $5,000, $10,000, $15,000 treatment plan that you present. And then you've got people that come in a fancy exotic car and they just delay treatment and you're not sure why. You can't judge a book by its cover, which is why we recommend that you present options to every patient all the time with every treatment plan. Explain it in writing. When you start discussing payment options or you talk about the cost of treatment, it can be very confusing for a lot of patients. So if you have something written, it is a lot easier for them to understand what those options are. And we can actually provide some custom tools for you to make that even easier for you. Okay, offer plans that reflect the borrower's need. We want to make sure that the patient understands that there's a couple of options, not infinite options, and not just one option, but a couple of really good options so that they can move forward and find a solution that fits their budget. Practice makes perfect. The more you do this, the easier it will be. Location matters. Should you present a complex treatment plan at the counter? No. No. So find the right location where you can have that conversation with the patient. Have some enthusiasm, okay? We have a tendency to sometimes project our feelings, whatever it is, onto the patient, so just be enthusiastic. And remember, the most important thing is that we provide a viable path for patients to receive optimal care. Okay, so a couple things to consider when looking at patient financing is, one, what is their reputation? I will tell you, we've been doing this for over a decade. We're formerly Springstone, and actually the people that started Springstone were the same folks that created the dental fee plan. So folks might remember that. We've been around for many, many years, decades of experience. We're part of Lending Club, and if you haven't heard of Lending Club, they are actually the world's largest online credit marketplace, and presently they provide more personal loans than any other bank here in the United States. Direct deposit in a couple of days, that's important. You want to get paid, right? Heads nodding, want to get paid. Also, I've observed anecdotally that patients who pay for treatment are more likely to make their appointments. Is that right? Another reason why we want to help patients go ahead and schedule and have that treatment paid for up front. No sign-up fees or monthly minimums, satisfied customers. We have nearly 90% of practices that use Lending Club would definitely refer us to someone else. So what about the customer service? It's also an area where some companies might decide they want to cut back on costs. Not with Lending Club Patient Solutions. It's something we're very proud of. We have a call center right here in the United States, And when you call, in less than 30 seconds, you will speak to one of our representatives. And if you hear a funny accent, it's because our headquarters is just west of Boston. We also have no phone trees, so whether you call or the patient calls, you're going to talk to a live person who will give you that solution, answer your questions that you're looking for. Okay, so we also want to make sure that we provide you with good information, just a sample of an email that will be provided to you once the patient has been approved with a loan. So now we get to the part where people ask, well, what does it cost? Okay, we're very competitive, and what we can do is we want to try to lower your cost of financing. And what do I mean by that? So many of our competitors have really tried to say it's all about no interest. And no interest is great, and it's very popular. It's also a premium solution that costs your practice the most. So I know that when you went to dental school, when you studied, you probably didn't learn how to run a small business. And it's really important that you understand what your margins are and that we're effectively trying to provide, really good solutions that are being sensitive to your costs. So we do have no interest options. We also have extended payment options, which have a lower cost. You probably don't have a lot of people choosing those longer term options, and there's a reason why. But we want to try to get more people from the no interest over to those longer term solutions where there is some interest but a low fixed rate. And that will lower your cost of financing. Okay, extended plans. The reason why most people don't choose those longer terms is because the interest rate isn't terribly attractive. And the cost of dentistry, as we've talked about, it could be $5,000, $10,000, $15,000. And if you had something that cost $15,000 or $20,000 and somebody said, and I'm going to give you an interest rate of 14.9%, what would your reaction be? Enthusiasm? Dismissive? So there's a reason why most of our competitors, they haven't seen a lot of people gravitate towards that, but we want to drive that cost down. So our cost is 3.9%, as little as 3.9% for those longer term loans, which makes it a lot more affordable, okay? No interest, true no interest. And what I mean by true no interest, if anyone has worked with any financing, 12 months no interest, patient gets their statement, there's this tiny little number there. If you just pay your bill, will you pay it off in 12 months? No. We want to be transparent. We have 12 equal payments or 6 equal payments. When we say 6 months or 12 months, that's exactly what we mean. We're more transparent. The other thing that's important is we have no retroactive interest. Retroactive interest is huge. So if you default on most private label credit cards, 26.9% back to day one. $10,000 treatment plan, heads up, right? And where do you think that patient is going to look to if they find themselves in that situation? You are de facto endorsing the financing company that you present to them. So it's important that whatever company you choose is reflective of the values of your practice. So it's important to have options. We can go out to 84 months. We can provide loans up to $50,000. Care today is expensive. What your part of the treatment plan might be a few $1,000s, but a lot of treatment plans, especially implant dentistry, they're very complex. So we uniquely have the ability to provide a loan. If it's just one arch, we can provide a $20,000 loan, and we can write a check to for the restorative part, and we can write a check to the surgeon for their part. Patient has one loan. So for example, on a $20,000 treatment plan, we can do that for as little as $334 a month. So what does that mean? That means for about $11 a day, we can provide that high quality care to your patients. And that's what is really critical, because we don't want you to just have increased case acceptance. We want you to have increased acceptance for optimal care. So I very humbly invite you to come to booth number 1447, where we can talk to you a little bit more about what I've shared with you today. It's truly an honor and a privilege to be here. I thank you so much for your time, and have a wonderful day.